Hey, welcome back to the Performance Prescription. Matt, hey, welcome back. Glad to see you.
Yeah, great to see you, Jared, and welcome, Shadi.
Good to be here. Nice to talk to you guys. Looking forward to it.
I'm really excited to have Shadi from Bethel Family Clinic on the program today. Bethel Family Clinic is really unique in its location and its approach. And what I'm really excited to dig into is the impact that Bethel's making in its local communities. So before I jump too far into questions, why don't you just introduce yourself and introduce Bethel Family Clinic? And I'm gonna give it away in Bethel, Alaska. So why don't
Yeah,
you
thank you.
introduce what you got going on?
Thank you. My name's Shadi Rabi. I'm the Director of Operations here at Bethel Family Clinic. I've been at Bethel Family Clinic for 6 years, and I've been in Bethel, Alaska for 10 years this July. Bethel Family Clinic's a small, federally qualified health center operating in Bethel, Alaska. Bethel, Alaska is the central hub of the Yukon-Kuskokwim Delta. So there's the Yukon River above us. Bethel is located on the Kuskokwim River, and those two rivers and everything in between constitute the Yukon-Kuskokwim Delta. There's 56 villages that are located within a 100-mile radius, about a 100-mile radius of Bethel, and Bethel operates like the hub. So people come into Bethel for medical treatment, for grocery shopping, to get out of Western Alaska. So you fly into Bethel to get to Anchorage, to get anywhere else you want to go, whether that's the lower 48 or other places in Alaska, you got to travel through Bethel. So it makes sense for a healthcare entity to be in Bethel as people are passing through. Bethel is also the largest community within the YK Delta. We have right around 6,000, 6,500 people that live full time in Bethel. And in the entire Delta, there is 25,000, around 25,000.
Wow. So thanks for sharing that context. You know,
Absolutely.
when I complain about driving 15 minutes to go to an appointment, that kind of puts that into perspective a little bit.
Yeah, it's a little different in Alaska, and then it's a little different in rural Alaska. So Bethel's constituted as rural Alaska, off the road system Alaska. You can't drive to Bethel, you got to fly. In theory, you could boat, but it's a long boat ride. And typically, barges are making that trip, right? Not your personal vessel. It's a large, big barge that makes a 3-week journey from Anchorage to get to Bethel.
So you're in a very unique context when it comes to healthcare. So tell us a little bit about the mission of Bethel Family Clinic and how it fits into the context of healthcare in rural Alaska.
Yeah, Bethel Family Clinic's mission is to provide affordable and quality healthcare to the individuals that live in the YK Delta. So our service area is the entire Delta. We operate 2 brick and mortar facilities in Bethel. So we have a dental facility, and then we have a medical and behavioral health facility that I'm actually sitting in right now. So to go back a little bit, there's 3 arms to our organization: primary medical care, outpatient behavioral health services, and dental services. So, you think about all the things that somebody could look for in terms of healthcare. We're typically the first stop. So primary medical care. So we'll see a person, and if there, is any reason to refer them to an outside entity, they'll start with us. Same thing with behavioral health care, and same thing with dental care. Dental, we can do a lot more than our other practices, but there is still the ability or the need to refer individuals out, and that's typically to Anchorage or Seattle, depending on the patient and what services they're looking for. But going back to the mission of Bethel Family Clinic, it's to provide a service, to provide this service for the individuals in the YK Delta and Bethel, to have a space where individuals can come to if, you wake up in the middle of the night and your 10-month-old has a fever and you don't really know what to do, and you are worried about them. We are that safety net for individuals. We see a lot of different things in terms of services needed. We get a big plethora of individuals utilizing our services. So our providers, our medical providers, are usually family practice. It's a little different family practice because it's such a wide range of services that individuals could potentially look for. And we try to be accessible, right? So we try to meet the patient where they are with their needs, and we try to operate as a family-oriented practice. So we're not the large hospital, right? We're the federally qualified health center that's operating in an extremely remote area. We want the individuals to feel comfortable when they come and utilize our services so that they feel like their needs are met, the service is at a high level, and, they're comfortable coming back and continuing to receive services for years to come. And we're looking to serve the community in any way that they need to be served.
How are you reaching people in these remote communities? How is Bethel Family Clinic making an impact in these communities?
Yeah, so it really comes down to, three main aspects if, I think about it from a grand scheme. One, they come to us, right? So they're hopping on a plane, they're getting in their boat, they're driving on the ice road when it's available. They're coming to us. But there's a lot of logistics that make it challenging for an individual to sometimes come 100 miles to receive healthcare services. One is the weather in the winter, and winter is a long period in Alaska. We're very far north. So the weather is consistently bad. So when you think about doing a snow machine trip or doing a boat trip or driving on the ice road, the weather has to be compliant, right? There can't be a whiteout condition or high winds or any weather situation can potentially make that individual not be able to show up to their appointment, right? And then you think about maybe the weather's okay when they're traveling to Bethel, but they also have to travel back from Bethel, right? So if they can't make it back contingent upon weather, then you gotta find a hotel. You gotta find a place to stay. And potentially that's not just one person, that's a person and their family. It's little kids as well. So when you start thinking about individuals, patients coming to us, it becomes a little challenging. The second method that we've utilized is going to the patient, right? So going to the villages. And typically we boat, snow machine, or fly to those places. We fly a lot. So we contract a local pilot here and charter his plane. So we charter our medical team to go to these places. Over the last year, we've probably traveled to 32 to 40 of these locations and provide services. But there's logistical challenges surrounding that going to them as well, scheduling, paperwork, billing. So it all gets a little more complicated considering the infrastructure that are located in these villages, right? We don't have the infrastructure here that is accessible in the lower 48. So the second method would be traveling to them. The third method is implementing technology, so telehealth, right? So nowadays we can hop on a video call just like we're doing right now, and we can catch up. We can talk about, if there's a medical problem, if there's a behavioral health problem, if there's a dental problem, it's not as applicable, right? Because a lot of the times our provider has to see the person, see the mouth, and see what's going on. But technology is also implemented to try to get that first, handshake. Hey, what's going on? What can we do? And then maybe it goes to the, downstream a little bit to either them coming to us or us going to them. So those are the three main methods we utilize to assist individuals in utilizing our services.
When you and I had chatted previously, you mentioned that sometimes your team is staying in these villages overnight. So what does that look like to
Oh,
do
yeah.
it?
So it's a glorified camping trip. And it's maybe not the camping trip you're thinking of the Grand Canyon or these beautiful mountain ranges, but our medical team, usually between 2 and 3 individuals are packing all their gear. They're packing their medical equipment, they're packing their personal supplies, right? We use cots, we use air beds, we're packing our food, we're packing our coffee, we're packing everything. And this medical team is traveling for it usually is a day to, anywhere between a day and 7 days, depending on weather. So we've been stuck in villages before and locations before for upwards of a week where, there's a system hanging out on the coast and it's just not going anywhere. And the winds are consistently blowing 40 to 50 miles an hour. No plane can get in. We're not going to boat in that weather. We're not going to snow machine. So you're stuck. Right. So you got to account for those extra days. But really, we're setting up shop in a school typically. And those 32 or 40 villages that we visit annually, you're setting up your cot in one room, you're setting up your food in one room, and then you're setting up the mobile clinic in another room. Individuals are coming through, sometimes as many as 20 to 30 patients in a day in these locations. And then our staff are sleeping there. They're waking up, they're doing the same thing the next morning. And then we're typically having a plane there and flying them somewhere else immediately to do the same thing at a different location.
So your staff is obviously committed and dedicated to the cause of healthcare and helping the community in Bethel. When you're thinking about your team and your staff beyond that level of dedication? What's something about your team or staff that you're really proud of, or makes them stand out?
Yeah, I think you hit the nail on the head, Matt. The staff that we have here, they're not, for a lack of a better definition or a summary, they're not here to get the paychecks, right? They're here to actually make a difference and do the hard work, right? So when we interview any individual that's coming on that's new for, let's say, the Village Travel Program, it's a very transparent conversation about what the job is, what the challenges are gonna be, what the benefits are gonna be. I'm very transparent with individuals because I don't want them to come into a situation that I didn't realize this is what it was, right? So I'm very transparent on the front end, like, look, this is gonna be unique, this is gonna be challenging, but ultimately, this is going to be extremely rewarding because I'm not familiar with other individuals that do medicine like this, right? I'm not familiar with healthcare that operates like this. So you get those adventure individuals that want some adventure, want some rural Alaskan adventure with a mix of quality healthcare, with making a difference. So we see a lot of individuals, and going back to your question, it's the energy of the staff members, right? So those type of individuals and the type of individuals that we've had long term working on these programs and working at Bethel Family Clinic, they're bought into the mission, right? So there's no managerial work that you have to do to convince the individual that this is important or that this is meaningful or that this is, you know, going to lead to a better outcome for these individuals. When individuals are already bought in, they already bring that unique energy, which in my experience is exceptionally valuable. If you have individuals bought into the mission, bought into what we're trying to do, we're going to accomplish everything that we're going to accomplish easier than, the other end of the spectrum. So we don't have to motivate staff in that regard. Typically individuals are, motivated to stay a little extra to do, to complete that referral or to make that phone call or to touch base with the village that we're traveling to figure out the logistics of when we're coming. So it makes it a lot easier when, the entire staff is bought in on the mission and what we're doing.
I just want to commend the work that, and like not let it go unnoticed of, yeah, so we're chartering a pilot, to get people back. We're driving along the ice road. I just think is worth calling out.
That's great. Absolutely great. And then real quick. So Shadi, a minute ago, you were talking about how Bethel connects with the community, whether it's people coming in, whether it's you going to them with the travel health program, which we just chatted about, and the technology. But then when you and I chatted previously, you mentioned that sports physicals are an inroad into your practice. I just thought that, I mean, that's something I think that will resonate with a lot of hospitals and healthcare centers, but I don't think of Alaska and sport physicals going hand in hand. So can you tell us a little bit more about that and why that's such a positive impact?
Yeah, absolutely. So athletics are a huge part of life here in Western Alaska, and basketball is a huge sport in Western Alaska. So individuals in the YK Delta, so right, 56 locations, 56 schools in these locations, all of those individuals that live in those communities, go to school, want to participate in athletics, needs a sufficient sport physical on file to participate in athletics, right? Just like the lower 48 to say like, this John Doe or Jane Doe is healthy enough to participate in athletics. In Alaska, you have the same thing, but you also have those travel logistics that we're talking about. So a lot of school districts will reach out to us or we reach out to them saying, hey, we'll do these sport physicals for you. And we'll come to you and we'll dedicate, X amount of days based upon your patient population or your student population. And we'll see every single kid that wants to be seen. So they have these locations have challenges because of what we've discussed, getting to us or us getting to them. They're not going to be able to participate if we don't get there, in the next month and see this cohort of kids that need to be seen. Do a lot of sport physicals for the local school districts and travel to these locations, see upwards of 100 kids at locations, complete the physical and then come back and sign them off.
And then I'm imagining that it opens up, inroads and relationships where
Absolutely, you're right on, Matt. Yeah, that starts the conversation. That's it. Oftentimes when we're in these locations specifically for the student populations, we'll get teachers or we'll get community members that are like, oh, there's a provider here. I'd love to see somebody. I haven't seen a provider in, X amount of months. And I've been wanting to get, XYZ checked out, and we'll check them out if we're there.
What makes you successful at Bethel Clinic, and what do you enjoy? Why do you love living in Bethel?
Yeah, absolutely. So first, I would say, it's definitely not me, right? It's our team members. It's the individuals that are doing this on a day-to-day basis. It takes a village, really. So our entire staff that are working day in and day out on these projects at Bethel Family Clinic, the benefit is them, right? The way we are able to accomplish all this is them. And for me, personally, I think it's being flexible, right? So it's not black and white every day. It's not, this is what we have to do. We have to fly to these locations. It's, well, how can we think about this uniquely and creatively to accomplish what we're trying to accomplish? And I think a lot of the times, from my personal experience, it's not the first idea you have or the first structured thought you have on how to accomplish this. It's thinking, it's, reaching out to the individuals that are located in those locations and talking to them, having a conversation like, hey, what do you think about this? Do you think it's, is this the best method to implement to achieve what we're trying to achieve? And again, it comes back to a lot of flexibility and being able to pivot quickly to ultimately accomplish that goal of seeing that patient or bringing that patient in to be seen, or hooking them up with technology to, at least have a conversation about what's going on and be able to provide some insight to whatever troubleshooting method we're utilizing. A lot of times it's just, talking to somebody and making sure that you're feeling heard. And for me, the biggest aspect of, my career and my life in Bethel has been flexibility and, understanding that sometimes it's a moving target, and that's fine. Like you got to be okay in that realm. And how do you be successful, right? And that's ultimately what it comes back to a lot of times. It's like, how can we provide the service that we need to provide under the parameters that are complicated? Sometimes you got to think creatively, or you got to, update a policy or procedure to fall in line with what you need to do to meet your patient where they need to be met. And for me, Bethel has been, excellent. I can't speak highly of it enough. I've really enjoyed my work experience at Bethel Family Clinic, my personal life in Bethel. And for me, that's a huge fundamental piece of who I am, right? You're spending a third of your time at work on average, oftentimes more than that. And being able to fully be behind what we're doing, for me, has been very enjoyable. So for me, that's really what drives me. And again, I want to reiterate that it's the staff. It becomes challenging in Alaska, as you guys are probably familiar. It's cold. It's a -11 right now. And you get a lot of dark in the winter, right? So it's making sure that you're cognizant of those feelings, and how you're doing and what you're doing, and making sure you're communicating that to your staff member and hoping that they're communicating it to their people that, they have contact with. So it's a lot of culture is a huge thing for us here at Bethel Family Clinic, and we really, really try to take care of our staff members. So in return, they are operating as the best that they can to provide this challenging service that every day we're working on.
That's awesome, Shadi. So thank you very much for your time. And I love, the theme of flexibility and creativity and working as a team around difficult parameters, you said, to accomplish great results for your community. So I really appreciate your time with us, and appreciate the work that Bethel Family Clinic is doing for your community.
Absolutely. Thanks for the opportunity, guys.